CNA Dietary Violation Education. Welcome to the quiz. Question 1. You are feeding a resident and they begin to choke. They are conscious but cannot speak, cough, or breathe. What is the next step? Option A. Leave them to go get the nurse or call for help. Option B. Perform the Heimlich maneuver, abdominal thrusts, immediately until the object is expelled or they become unconscious. Option C. Continue offering them small sips of water to help wash down the food. Option D. Slap them on the back several times to try to dislodge the object. The answer is B. The Heimlich maneuver is the standard for conscious choking victim with complete obstruction. Option A is incorrect because leaving is unsafe. Option B is correct because the Heimlich is the standard for conscious choking victim with complete obstruction. Option C is incorrect because water can worsen obstruction. Option D is incorrect because back slaps are for infants. For adults, abdominal thrusts are used. Question 2. Which of the following is a violation of a resident's right to privacy and confidentiality? Option A. Discussing a resident's care plan and needs during the shift report in the private nurse's station with other staff members. Option B. Talking about a resident's personal and embarrassing behaviors with your friends in the cafeteria during your break, using the resident's name. Option C. Posting a resident's daily schedule and care preferences, e.g., prefers shower in AM on a small whiteboard in their room for staff reference. Option D. Telling the oncoming CNA during report that a resident was incontinent twice during your shift. The answer is B. Sharing personal information with non-staff in a public place violates privacy. Option A is part of professional report and is acceptable. Option B is correct because sharing personal information with non-staff in a public place violates privacy. Option C is acceptable for staff communication in the room. Option D is part of professional report and is acceptable. Question 3. A resident with expressive aphasia, difficulty speaking, is trying to tell you something and is becoming frustrated. What can you do to help facilitate communication? Option A. Remain calm, give them your full attention and plenty of time, ask simple yes/no questions, and encourage them to point, use gestures, or use a communication board. Reassure them that it's okay and there's no rush. Option B. Tell them to slow down and speak clearly so you can understand. Option C. Finish their sentences for them to save time and reduce their frustration. Option D. Walk away and come back later when they are calmer and less frustrated. The answer is A. Patience and alternative communication methods reduce frustration. Option A is correct because it reduces frustration by being patient and using alternative methods. Option B is incorrect because they may not be able to control their speech. Option C is incorrect because finishing sentences can be frustrating and inaccurate. Option D is incorrect because leaving avoids the issue. Remember, we can take your CNA exam for you, remotely and undetected, and with 85% score guaranteed, no fails, no upfront fees, no deposit, pay only after results. Message us via number in bio to schedule your session. Question 4. The care plan states that a resident requires total care for bathing. This means: Option A. The resident is completely dependent on the nursing assistant to perform the entire bath for them, from start to finish, with no participation. Option B. The resident only needs help with washing their back and feet. Option C. The resident can bathe themselves with minimal setup of supplies. Option D. The resident needs supervision and verbal cues for safety during a bath. The answer is A. Total care means complete dependence on staff. Option A is correct because total care means the resident cannot participate at all. Option B is partial assist. Option C is minimal assist. Option D is supervision. Question 5. A resident who is on bed rest needs their linens changed. What is the first step in performing an occupied bed change? Option A. Explain to the resident step by step what you are going to do to gain their cooperation and reduce anxiety. Option B, lower both side rails to have full access to the bed. Option C, remove all the soiled linens at once to get them off the bed quickly. Option D, roll the resident to the far side of the bed and raise the side rail on that side for safety. The answer is A. Explaining the procedure first helps the resident understand and cooperate. Option A is correct because explaining the procedure first helps the resident understand and cooperate, reducing anxiety and ensuring safety. Option B is incorrect because lowering both rails is unsafe. Option C is incorrect because removing all at once leaves the resident exposed. Option D is incorrect because rolling without explanation may startle. Question 6. What is the main purpose of a client care plan or service plan? Option A, to outline the specific, individualized care, goals, and interventions for a resident based on their initial and ongoing assessments to ensure all staff provide consistent and appropriate care. Option B, to provide a daily work schedule and task list for the nursing assistants. Option C, to list the medications a resident is taking and the times they should be given. Option D, to inform the family of the resident's medical condition and progress. The answer is A. The care plan is a guide for consistent, individualized care. Option A is correct because the care plan is a guide for all staff to provide consistent, individualized care. Option B is incorrect because it's not just a task list. Option C is incorrect because medication list is part but not the whole. Option D is incorrect because it's for staff, not primarily for family. Great job! Don't forget to subscribe. Bye!